Some of the things we need to understand is this is for adults. One, all the teeth must be there. All the teeth must have, the eruption should have been completed. You can't use this for kids or mixed dentition. Two, you should have enough teeth in the mouth to hold this appliance. Okay, like in any other appliance that you're going to give, you need to have enough teeth in the mouth. The teeth need to be not periodontally compromised. This patient will come to you saying my teeth also came out. Because the appliance has to be fit snugly for it to work. Next, if any crowns that are ill-fitting, anything is there, inform the patient, tell the patient it's better to get it changed. If you have to give implants and all of that, wait, get it done, or inform the patient accordingly. A few clinicians have asked us to block out that area and I will give the implant later. I told them, see, later if it doesn't fit, it is not like crown and repeat going in this thing. This is an expensive appliance. Why? Because it's, first of all, it's not available, it's not from India. Second, manufacturing this is also very expensive. So, some other things that you will evaluate for, now for all of this there are some YouTube videos also which you can look at. Okay, this time is short, we're not going to details of that. Example, we need to get baseline data. What is the patient's present condition? What is the patient's present joint condition? What is the patient's present oral condition? So that later on you can monitor and compare. Okay. So it's a okay. Now, what do we do? Now comes to the aspect as a practical aspect. We do this examination, we note down everything, and we get a consent. Most importantly, okay. Please don't tell patients use pannanga nalake super aidum. Okay, it's not like that. It takes some time for you to get to sleep properly with this appliance. Okay, so some people within 2 days itself they sleep well because it's such a relief. For me, it took me I think 1.5 weeks to sleep well. So you need to sleep, and for that you can tell patients to first wear it and do their routine activity maybe an hour before they sleep, and not just keep it in the mouth when they're trying to sleep. So we'll come to that later. First, what do we need? We need scans. Impressions also possible. Scanning is more accurate, so the team can come and take a scan. We will need scans, and what else would we need? Very correct, sir. We will need a bite. Now that is the most important aspect from a clinician perspective. It is not a normal bite that we need. Whenever we give an, why I say this is there are many people who give this other appliance also. They take a normal bite, the lab just advances it on the articulator, and they fabricate. That is not correct. Whenever we do oral appliance therapy for OSA and for snoring in OSA, we need to take a protruded bite. Okay? Now, how do we take that bite? So, we generally need to use something called a bite fork to take this bite. Okay? Now, why do we need a bite fork? Why do we need a bite fork is, if you notice in this appliance, you have the air channel inside, right? So we need 3 millimeters for incorporating that air channel and at least 1 mm per upper tray and lower tray for the thickness. So we have incorporated that into this bite fork. Okay? This is what a bite fork looks like. So there are 2 types of bite fork, okay, which is passing around the bite forks. There is a single-sided bite fork and there is a double-sided bite fork. Okay, why is there a single-sided and double-sided? I will tell you. Now double-sided. Now here you can see 2 slots. Right? Can you see 2 slots there? You'll also be seeing this. Can you see 2 slots? No, whatever. They would have got inside. right? Can you see 2 slots there? So when you bite into those 2 slots, it brings your jaw to the edge-to-edge position. So the edge-to-edge position is a good starting point, okay, for starting the treatment. It is not a final position. But not all patients can bring it to edge-to-edge. If you are a class 2, you will not be able to tolerate an edge-to-edge position. Which is why, or if it's class 3, basically if it's a class 3, again we will need to see what is the range of the patient's motion to see whether an oral appliance therapy will be effective or not with the DreamWell or with any other appliance. So in a class 2 patient,